Well, joining us live right now is Dr. Eric Robinette. He is a pediatric infectious disease specialist at Akron Children's Hospital. And I invited Eric on to the show because you've seen the new CDC guidelines, emergency use for vaccines now for the ages of 12 to 15, 12 plus. So that is big news as far as getting the vaccines out. What about parents saying, do my kids, do my teenagers need the vaccine when we talk about the battle against an infectious disease like COVID-19? And Dr. Robinette, why don't you take the story from there and talk about how you look at this vaccine now available for the ages 12 plus?
Sure, Ray. Thanks for having me on. So, when I think about a vaccine, the two questions that I ask, I think probably are the same questions that everybody else asks, which is, does it work and is it safe? And so, I think I always want people to understand that, although this vaccine was developed and studied very quickly, it was also studied extremely thoroughly and extensively, and looking at the data for not just adults, but also the more recent data for 12 to 15-year-olds, and all of the post-marketing data from adults that we have, the tens of millions of doses of the Pfizer vaccine that we've given. The data is very clear that it's a very safe and a very effective vaccination. So I think that's, the first thing that I ask. And then, I think the question about 12 to 15-year-olds that you're probably getting at, that a lot of people have, is, people understand that COVID is less dangerous to an adolescent than it is for an elderly adult. And so, do they really need the vaccine, I guess, is the question some people would ask. And I think there's three things that we have to consider. So one, since the pandemic began, 1.5 million adolescents have been sick with COVID. And, with that's people that are missing school for 10 days, feeling ill, needing to be taken care of, right? So it's a significant impact to be sick with it, even if you're not hospitalized or not at risk of dying from it at a high level. Still 13,000 teenagers have been hospitalized. So even though it's not as likely to cause a serious illness in an adolescent, it's not impossible. And the third thing is, 40,000, they've estimated about 40,000 children in the 11 to 17 age group have lost a parent to COVID. And although we don't understand necessarily the extent to which the vaccine reduces transmission, we know that it does help reduce transmission. And so that's an important role that vaccinating adolescents plays.
With us is Dr. Eric Robinette, again, pediatric infectious disease specialist at Akron Children's Hospital. And Eric, we've learned a lot about COVID-19 in the last 15 months. Some things we thought that we really weren't as important. And then there's been aspects of this battle that maybe we didn't know that now we know about COVID-19 here 15, 16 months later. When we look at the ages 12 plus and the role they have, unfortunately, in COVID-19, we've heard asymptomatic. We've heard about them being haulers and carriers of COVID-19. Is that a significant role in this battle against this virus?
Yeah, absolutely it is. Now, I think there's so much information on COVID-19, and it's hard for people to sort out what's true and what's not true. It absolutely is true that adolescents have a higher rate of asymptomatic infection, and that they can transmit COVID-19 to others, and they do transmit COVID-19 to others. There have been some, statements of children being super spreaders, like they are for other viruses. That probably is not the case. They're probably just regular spreaders, but they're still spreaders. And anytime we can eliminate a link in the chain of somebody that can get sick with and or spread COVID-19, we protect everybody, not just ourselves. And so that's an important, definitely an important piece of the consideration. And there was there's been a lot of discussion about how much does vaccination reduce, transmission. And we're still studying that, but I saw a paper relatively recently that showed a 55% reduction in asymptomatic illness in adults who had been vaccinated compared to those who had not been vaccinated. So we certainly have enough evidence to believe that it does have a substantial impact on transmission, and it doesn't necessarily mean that it's a magic bullet that makes it impossible for you to transmit it, but on a public health level, it's significant.
Dr. Eric Robinette is with us again, pediatric infectious disease specialist with Akron Children's Hospital. Some parents might be apprehensive, saying, okay, the vaccine, Eric, is out there for adults, but what about that same dose going into my teenager's arm? How will that affect them? And I guess take me into the lab a little bit and talk about the dose, the vaccine that the 12 plus will get. Is it the same as an adult, or is it different?
So it is the same dose, as far as how we study vaccines, we always study them in adults first, and you saw that with the COVID-19 vaccine, and, we've taken that same approach, and then we sort of slowly extend the trials down into younger and younger children. So we understand that children are not just little adults physiologically, and that is reflected in that approach to studying. However, a 12 to 15-year-old is physiologically a lot closer to an adult than a 6-month-old or a 6-year-old, right? And so for this study, what they actually did was an extension of the adult trial. So they basically added 12 to 15-year-olds into the adult trial protocol. They studied the same dose. And that gives us some advantages in that that's a dose that's already very well understood. And what they reported essentially was that the side effect profile in the children was very similar, mostly, the same kind of mild to moderate side effects and the same rates that they were seeing in adults. And the children actually produced higher antibody titers, which is sort of expected. That's the biggest difference between a 12 to 15-year-old and an older adult, is that they tend to produce more robust immune responses after a vaccination, which is a good thing as long as it doesn't come with more side effects, and it didn't appear to come with more side effects.
Eric, how important is this? Is this a game changer now that the vaccine can be distributed to the 12 to 15, 12 plus crowd?
Yeah, well, I think the vaccine in general is a game changer. Vaccines are, without question, the most powerful tool that we have to fight infections. As someone who treats infections every day for what I do, if you ask me if I had to give up every tool in my armamentarium except for one, what's the one that I would keep? And that's a vaccine. Vaccines are game changer is the perfect word for what a vaccine is when we're talking about fighting infections. As far as the 12 to 15-year-olds specifically, it's a huge step in the right direction. Every group of people that we can protect is going to end the pandemic faster.
With us is Dr. Eric Robinette, pediatric infectious disease specialist, Akron Children's Hospital. And then, Eric, wrapping up our conversation this morning, then I wanted to talk a little bit about what Akron Children's is doing with this panel discussion that you're a big part of. But, Eric, we're talking about 12 plus now. Is there clinical testing going on for the vaccine for under 12?
Yes. There's a clinical trial for the Pfizer vaccine for 6 months to 11 years old. So that's available, through enrolling in a clinical trial. And they are testing, to your question earlier, Ray, they are testing different doses for that age group. And so that's a trial that's going to take a little bit more time. I understand they're hoping that they'll have results in the early fall. But yeah, that trial is ongoing for the 6 months to 11 years.
Well, let's talk now about Akron Children's. You're part of it along with Dr. Bigham as part of a panel discussion you've put together for an education coming out of Children's and COVID-19.
Yeah, so we just, we know from our own experiences living in the same world as everybody else that it's actually very difficult to get accurate information about COVID-19 and the COVID-19 vaccines, and there's a lot of competing voices out there. And as Akron Children's, we just really, really care deeply about the health of the children that we serve, and we want their parents to have the best possible information to make good, healthy choices for their kids. And so we put that panel discussion together just to share what we know with you all.
It's available, akronchildrens.org, akronchildrens.org. to get more information. Eric, thank you for the time. Terrific information this morning. Appreciate you squeezing us onto the calendar, but I saw you're part of the panel. Haven't had you on the show yet to talk about this, and we've had different infectious disease doctors join us. I thought it was real important to get you in on the pediatric side. So thank you for the insight this morning.
My pleasure, Ray.
Dr. Eric Robinette, infectious disease doctor, Akron Children's Hospital, joining us live this morning here on WAKR.